The latest data show a rapid rise in cases just as the last of the lockdown rules are about to be rolled back. The R number, a measure of how fast the virus is spreading, is now between 1.2 and 1.4, roughly the same as last week. But new figures from the Office for National Statistics show more than 652,000 people in the UK are estimated to have been infected in the week up to July the 10th. That's a rise of almost 63% on the previous week. And just look at how the third wave has picked up speed. At the start of June, the weekly rise in cases was just 7%. Scotland still has the highest rate, with 1 in 90 people infected. But England is catching up fast. 1 in 95 had the virus. Rates were much less common in Northern Ireland, where 1 person in 290 was infected, and in Wales, where it was just 1 in 360. Within England, the prevalence was by far the highest in the northeast, with 1 in 30 people infected. But there's big regional variation. Down in the southwest, just 1 in 108 had the virus. And it's still far more common in young people, 1 in 35, compared to 1 in 500 of those over 70. So what happens next? Well, self-isolation is a key part of the strategy to control the virus. But separate data from the ONS shows 1 in 10 people aren't fully self-isolating after being told to by Test and Trace or the app. A third of those isolating develop symptoms themselves, underlining its importance. Anxiety about the lifting of legal restrictions next Monday is high, with 57% of people telling the ONS that they're worried. 64% intend to keep wearing face masks in shops and a similar proportion on public transport. 60% say they'll keep avoiding crowded places, and almost a half will stick to social distancing. On every measure, the young are more likely to return to normal behaviour than older adults. Monday is a critical moment in this third wave. How bad it gets is partly down to vaccine uptake, but also our appetite to stay cautious, even when the rules are lifted.